job with all those names, all those places they come from. A round of applause. Go for that. That's a hard job, it really is. I just want to say thank you so much for having us here. Long Beach Medical Center is your community hospital. We hope you think of us that way. And I'm really delighted that we have this opportunity to bring to you some education and some awareness about asthma, but also to learn maybe a little bit more about who we are, what it is that we do. Most people don't think of a hospital until they're sick, So if you're healthy and you're well, we're not your first thought. But I want you to know that we are here, for you. We do have high-quality doctors, wonderful care and compassionate nurses, and I hope that you will use us if you ever need. Hopefully I won't see you again except for presentations like this. I hope that in the future we can do a few more like this, because there's a lot of topics that we can cover and a lot of education that would be helpful to everyone. So I hope you have a new friendship. I really do. I want to thank just the Robert Gause Foundation for inviting us here and making this connection. I really appreciate that. And I think that the work that you're doing is wonderful. I'm happy to be your partner. And I also want to say hello and thank you to my new friend Marcus, because he was very helpful with getting things put together. So I really appreciate it. Without saying more, I want to introduce to you Dr. Max Frascus. He is a physician at the medical center. He works through our family care center. And I don't know if you've had any experience with the family care center, but it is a very warm, welcoming place. We have wonderful staff that are there. They have internal medicine, pediatric medicine, adolescent medicine, as well as a lot of specialty type doctors who work through there. So it's really a great resource. The other good thing about it is they do accept all different types of insurance, and if you don't have health insurance, they work on a sliding scale basis as well. And they'll also have counselors who will help you get onto insurance if you're eligible for the insurance. They'll go through the paperwork with you, sit with you, go through all the forms that need to be done. And they're really very caring and very concerned. So if you haven't been there before and you do need, not only when you're sick, but for prevention also, that's a big piece of staying healthy, is to do the things that you should do to keep yourself from getting sick. And the Family Care Center can do that. So without saying more, I want to get Dr. Frascus on to his lecture. Dr. Max Frascus, he really is a doll, and I thank you for coming out tonight also.
Hello everyone, thank you very much for having me here today, and hopefully we get to learn something. So, asthma. What exactly is asthma, and how does it affect us? A lot of people think asthma is just difficulty breathing, and it's a little bit more involved than that. So, one of the first things that happens in a person with asthma is that they are very sensitive to exposure, to the air around them, to the people around them, the sense around them, and when they are in a situation where they are exposed to these items, they become very hypersensitive. And when that happens, if you see on the left, we have a regular airway. It's nice, open, pink. Air moves easily through it. It's like drinking through a regular drinking straw. Now on the right side, you'll see the diseased airway, the asthma airway. Okay. One of the first things that happens is that the airway gets smaller. It decreases in size and it gets inflamed. So all of a sudden, from breathing through a straw, you're breathing through a cocktail straw. And you can only imagine how hard that is. Now, to make things worse, you also have a lot of mucus production, okay? And it even blocks certain passages. So instead of using your whole lung, you're only using bits and pieces of it. And your body reacts to this. It starts coughing. It tries to clear all this air, all this mucus. It tries to clear the air passages. Now, people start to wheeze. Initially, when it happens, the wheezing is very slight, and you need a stethoscope to hear it. But the more severe it is, a lot of times you don't even need a stethoscope. You could just stand by a person, and you can hear the wheezing happen. Alrighty? So, how many people have asthma? Unfortunately, a lot. Okay? Around 5 to 15%, depending on the study that you look at, of the U.S. population. And what does that mean to us? Well, approximately 13.9 million visits to the doctor's office occur annually for that. Okay? 423 hospitalizations occur annually. And it costs us, insurance companies, the U.S. government, over $6 billion. Some estimates are even closer to double that. Okay? So, who gets affected the most and what can we do about it? About 10 to 12% of the children in the United States have asthma, and this is steadily increasing throughout the years. It usually occurs in boys when they're children, and it's a ratio about 2 boys to every 1 girl that has asthma. But unfortunately, as we get older, that ratio becomes 1 to 1. And 2/3 of all asthma cases are diagnosed before the person is 18 years old. So, who's at risk for asthma? Family history plays an enormous part in it. Okay, a child with one family member with asthma, a dad or a mother, he has a likelihood of 30% of developing asthma in his or her lifetime. If both parents have asthma, that ratio goes up to 70%. Okay? If you have other diseases that, so-called atopic diseases, such as eczema, allergic rhinitis, the risk increases. Okay? If you had a low birth weight, if you were premature, that risk increases. If you have frequent respiratory infections, sinusitis, bronchitis, that ratio increases. Okay? If you smoke, if you've been exposed to tobacco smoke, that also increases. Now, a certain population also suffers from nasal polyps. What are nasal polyps? It's little tissues, little bits of tissue that grows in your nose that blocks your airway. Okay, and there's a triad that causes nasal polyps, to be sensitive to aspirin, and have a severe asthma attacks. So those patients need to definitely have their nasal polyps removed, not take aspirin, and try their best to control their asthma. So, what triggers it? Okay, any type of infection, viral infection, bacterial infection. Allergic exposure to trees, grass, weeds, pets, molds, dust, foods, pretty much anything that you might be sensitive to. Cockroaches, dust mites, bed bugs, pretty much anything. Chemical fumes might set it off. Cleaning your bathroom, cleaning your stove. Like I said before, aspirin in people with nasal polyps. Also, another very huge trigger is cold air. In the wintertime, it's very cold, it's very dry. That will cause asthma to get much, much worse in people. People under a lot of stress, strong emotions. Acid reflux can also cause asthma. And exercise too. All right. So, what are the signs of it? A parent should start becoming concerned when they hear their child wheezing. Okay? If they are chronically coughing, with or without sputum. If they breathe rapidly, especially when they're just sitting down, or if you see them playing with other children and the other child is not really wheezing, not being fatigued, but your child has problems. Their lips are turning blue. They can't seem not to be able to catch their breath, even though they're doing very minimal running or playing hide and seek. Right? Chest tightness, chest pain, feeling weak, tired, having difficulty sleeping at night because of coughing, constantly waking up. So, now all these symptoms may vary from person to person and from episode to episode. So you have to always be constantly vigilant and try to identify what exactly is going on. And it's very hard to do. All right. So how do we diagnose asthma? And more specifically, what does the doctor do when you go to his office? Okay. One of the first things he does is have some blood work and a chest x-ray. Now, this basically tries to rule out anything other than asthma. Okay. Unfortunately, you can't see asthma on the chest x-ray, but you can see a bronchitis, you can see a pneumonia. So you know if there's antibiotics to be used or if antibiotics are going to be useless. Blood work may reveal something called IgE and eosinophilia. And these are types of antibodies and white blood cells that are found elevated in people with allergies, asthma, allergic rhinitis. So, what else does the doctor do? In people with allergy, they'll send them out for a skin test. This can also be done as a blood test. So, usually specific doctors called allergists do the skin testing. And what they do is they take some fine needles, kind of scratch the surface of your skin, and on that they'll put a specific fluid that contains the allergens that you may or may not be exposed to. After a little bit of, with the fluid on your skin, they'll look and see if there's any redness, any reaction to that fluid. And that'll give them an idea whether or not you are allergic to that specific chemical, or pollen, or tree, and so on. Now, in the doctor's office, when you first go see the doctor, they'll do something called a peak flow monitor. Okay? This is a very basic instrument. It's basically a hollow tube with a little meter on the inside. And what the doctors ask you to do is to take a nice deep breath in and blow out as hard as you can, as fast as you can. Okay? And they'll record a number on that. And they'll ask you to do that 3 times. Okay? And they'll take an average. And that number is going to be different for everybody because everybody's size is different. So they kind of correlate that with the size of the person and see how well they are breathing. Okay? If you're not hitting 80% of what the normal person your size can achieve, then you're going to need some medication. Pulmonary function test is pretty much the hallmark for determining asthma. Okay? What you do, and this is very complicated, but it's a computer that has a tube attached to it and a mouthpiece. And the technician or the doctor will tell you exactly how to breathe and when to breathe in. So what you do is you take a nice deep breath in, and as hard as you can, as fast as you can, let out all the air, and continue to let out all the air until they say stop. And then take a nice deep breath in. The computer will analyze this and give us a diagram of how well your lungs are functioning and whether or not you have any obstructive disease. So how do we classify asthma? How do we know asthma is not so severe, pretty severe, or dangerous? So the 4 classes are intermittent, mild persistent, moderate persistent, and severe persistent. And we base this on the symptoms. So if you're experiencing any of the symptoms previously, wheezing, tightness in your chest, chest pain, and you experience these less than 2 days a week, then you're in the intermediate class. However, if you experience it throughout the day, you're in the severe class, and then you have mild and moderate in between. Okay? Nighttime awakenings. How often do you wake at night because you can't feel like you can't catch your breath? Is it less than 2 times a month, or is it every day of the week? How often are you using your short-acting inhalers? Less than 2 days a week, or several times a day? So we take all these calculations and we try to determine what's the best course of therapy depending on how severe your asthma is. So how do we treat this once you have it, and what are our goals? So the main goal is to try to maintain your normal activity levels. Don't have the asthma affect your life or your lifestyle. Okay? Control those asthma symptoms and try to maintain a pulmonary function as normal as possible for you. And the other main goal is, unfortunately, with every medication that we take, there are side effects. Okay? And you have to try to minimize these side effects so that way you don't create more problems for the patient or for yourself. All right? So we kind of use a stepwise approach. Every doctor is different. Every doctor has their own preferences. So what might be true for one person, another doctor might do something differently through their experience, the way they've been taught, or just what they believe works best. But overall, this is kind of a guideline for us to use. Okay? For those that have very minimal symptoms and are in that intermittent asthma stage, basically we just give short-acting beta agonists. What is that? Most people know that as a rescue inhaler. Okay? We're trying to go away from that term, but it's a medication. I have a sample right here. It's a small little one that you take, and within 5 to 15 minutes, it starts acting and helps you relieve all those symptoms that you've been having. They usually last for approximately 4 hours, okay? And they are very good for the short duration, short effects. But our ultimate goal is to have very minimal use of this and try to have no symptoms throughout the day. In order to do that, we usually use inhaled steroids, long-acting medications, and try to, with the addition of some, try to relieve all these symptoms, okay? So, as you can see here, there are six steps, and I'll go into a little bit more detail about the medications in a little bit. So the quick relief therapy, some of you may recognize the names. Albuterol is the generic name, Proventil, Ventolin, and Xopenex are the brand names. Xopenex is slightly different from the rest, but they basically work the same way. And you take that 1 to 2 puffs every 4 to 6 hours, depending on your symptoms. Okay. Then we have something else called Atrovent, ipratropium, and it works on a different pathway, but also we kind of use that in the short course to try to relieve your symptoms. Now, systemic steroids. These are the pills that you take to try to relieve the symptoms. They're called Solumedrol or prednisone, Medrol dose packs, so forth. We don't like keeping patients on this for very long periods of time because they have lots of side effects. Some of the side effects include osteoporosis, which is the decrease in the bone density that you have, which causes you to have more fractures if you fall down, cataracts, and suppression of your own steroids that your body produces naturally. So the course of this usually varies from person to person, doctor to doctor, and unfortunately some people have to be on this for long term, but we try not to. Now, the long-term therapy drugs are the inhaled steroids. Their names: Qvar, Alvesco, Pulmicort, Flomax, Asmanex. You may have heard of some of these. Mast cell stabilizers. These affect certain cells within your body that releases histamine. Histamine will trigger an asthma attack, and this is known as chromium. Long-acting beta agonists, salmeterol, also known as Ceravent, but there are a few others. Those are inhaled one puff twice a day. And then your leukotriene modifiers. Again, these affect certain blood cells, and their brand name is Singulair, Montelukast. So there is an injection called Xolair, and basically this, you go to a doctor's office once a month, and it helps people with allergies and allergic asthma, and it kind of binds to certain chemicals in your body and prevent them from being inactive. And then you have the combination drugs, such as the Advair and the Symbicort. So these, again, we try to keep the patient on. Unfortunately, you're going to be on these for pretty much the rest of your lives because asthma is not cured. It can only be treated. Some people may have a decrease in their asthma symptoms as they grow older, but unfortunately that usually doesn't last for very long. And you might have asthma as a child between the ages of 8 to 12, and then go for a few years, 10, 20, 30 years. But unfortunately at some point you're going to be exposed to something downward treatment. So, what is an asthma attack? Well, people with asthma usually have a baseline, and they're at that baseline for long periods of time. However, every once in a while, they will have an asthmatic attack. It can be very sudden, within the course of a few hours, or it might take a few days of progressively getting worse. Okay? Those people will produce a lot more mucus than they normally do, and there's a lot more inflammation around their lungs. So air gets trapped, and you're unable to breathe that air out. So the air kind of gets stuck in your lungs. And they feel like even though their lungs have a lot of air trapped in them, they feel like they can't get enough air in. So, people might start having trouble sleeping. They might get very tired doing very little, just getting out of bed in the morning, walking down a flight of stairs, making dinner. They'll start developing dark circles on their eyes, get very moody, have poor appetite, have a persistent cough, trouble talking or walking, and their lips may turn even blue or gray depending on how severe it is. So, how to monitor for an attack and what we can do about it. I usually tell my patients to use their peak flow, the simple tube that you blow into as hard as you can, and see what measurement they get. Okay? If they're above 80%, then it's pretty good for them, and they can continue on their day with their current regimen. Okay? However, if that percentage starts to fall and starts going below 80%, between 50 and 80%, then I will advise them to take other types of medication, take some oral steroids, the prednisone, the Medrol dose packs, and see how they react to that. Now, if they have less than 50% on their peak flow monitor, that indicates an emergency. And those people should definitely go to the emergency room immediately. So what I like to do is to establish an initial treatment plan with my patients. And most doctors also agree with this. So you might want to discuss with your doctor. And now it depends on how involved you are with your own disease and with your own health. Okay, some people unfortunately are not very involved. So I can't really give them a long course of action to say if this occurs, please do this, or if that occurs, please do that. However, other people are very involved. They know their medications, they know their side effects, they know how they work. And with those patients, I don't mind giving them, extra medications, so that way if they do have an attack, they're able to prevent it very early on. So, an example of a whole management plan, I'll tell them take three treatments of their albuterol or a nebulizer treatment, and then reassess themselves in an hour. And if there's no improvement, I might increase the dose of their inhaled steroid for a short time being. If there's no improvement on that, I might start oral steroids or tell them to go to the emergency room. And usually the doctor kind of fills out a form and gives it to you, so that way you have that form at your home. And when you have these clinical signs and you don't have easy access to your physician or to an emergency room, at least you have something to go by and try to keep yourself healthy as best as you can. So, what happens in the emergency department? Well, unfortunately, emergency physicians don't know you as well as your family doctor. And that's why you have to have good rapport with your family doctor. So they will ask you a lot of the same questions that your family doctor has done in the past. They will determine whether or not your symptoms are due to asthma or if they're due to something else. You might get a chest x-ray. They'll provide you with some oxygen therapy. They'll treat you with some albuterol IV medications. And at that point, depending on how well you respond to all these treatments, the doctor will determine whether or not you get admitted to the hospital or you're able to go home. So, one of the subsets of asthma is exercise-induced asthma. This is one of the more difficult diseases to kind of diagnose and treat. And the reason is it doesn't always occur in people with asthma, but usually people with asthma have 50 to 90% do have these symptoms. Okay? This is when athletes, people who seem very fit, have asthma after they work out. So what happens when you play a basketball game, play a football game, go to the gym? Initially, your body tries to pump as much blood to the muscles as they possibly can. And in response, it wants to carry as much oxygen to your muscle as it possibly can. So your lungs expand, and the initial diagram where you saw those pathways, they also expand. However, after 10 minutes, it could start after 10 minutes, or even after you've finished with your exercise, half an hour later. Those air passages that have expanded now constrict very tightly. And they start experiencing symptoms that an asthmatic will experience. So, and unfortunately, these attacks are very intense and have a higher level of problematic outcomes. What do we do for these, and how do we diagnose it? It's very difficult to diagnose because a lot of the pulmonary function tests, despite the peak flow meters for these patients when they're not exercising, are normal, or even in the top of their range because they're very fit people. However, once they start exercising, they exhibit the decrease below 80% and very, very drastic changes. So a lot of doctors will send them to specialists that have certain equipment in their offices, like a treadmill or a bike, and make you work out and run and bike ride for a while just to see how you react while the pulmonary function test is going on. So how do we treat people with this? Usually, I tell them to take out their albuterol puffer, and 15 to 30 minutes before starting an activity, such as a basketball game or a football game, take 2 puffs, even if they don't have any symptoms whatsoever. Now, that might not be sufficient, so next step I might tell them to use an inhaled steroid or long-acting medication 30 to 45 minutes before a game. Unfortunately, the long-acting medications, on average, have longer onset time to make them work. And hopefully that will be enough. But unfortunately, a lot has to do with the person themselves. People who play sports, athletes, try to push themselves to the max. And they kind of have this idea of, let me push through this, it's only a temporary phase, I'll be able to overcome it and score the goal, score the touchdown, and so forth. Unfortunately, that really doesn't happen. And they have to learn that they have to stop their physical activity immediately. Once they stop their physical activity, to continue on with their albuterol pulse. And if that's not helping, call EMS as soon as possible, because it will only get worse. And once it gets worse, it makes it very difficult for the emergency room doctor, people at the scene, EMS, to treat the patient accordingly. So, a few true or false statements. Can you outgrow asthma? That is false. Okay? Like I said before, you don't really outgrow asthma. The symptoms might disappear for a while, but most likely they will reappear. Is an asthmatic cough contagious? Can you get sick from a person that's sitting next to you chronically coughing because they have asthma? No. there's not really a bacterial or viral process. They're just coughing because they can't get their lungs clear of all the mucus that is due to the hypersensitivity reaction. Is asthma curable? Can we cure it? Unfortunately not. And we can treat the symptoms, we can treat the disease, but you will be on these medications for a very, very long time. People with asthma should not exercise at all. That's false also. Okay? You should not stop doing what you enjoy. The key is to try to prevent the symptoms, try to keep you healthy, and make you enjoy your life. If you enjoy playing basketball, that's the goal, is to keep you playing basketball, keep you jogging, keep you cycling, whatever it is that you enjoy doing. Unfortunately, a lot of times, you might have to switch or only go out during certain seasons. Okay? If you know that the cold air is a trigger for you, don't do it during the winter time. Only do it during the spring, summer, fall months. You might want to also change the sport that you do. Swimming is very beneficial for you. So a lot of people that come to my office that still want to maintain shape, but they no longer want to undergo all these problems, I suggest swimming, and there's pretty positive effect to it. Can you get addicted to the asthma medication? That is false. Okay, these medications are here to help you. There are really very addictive properties to them, and you can continue on and stop anytime you choose. But we always suggest that you carry your medication on with you, and if you need it, take it. So, if anyone has any questions, I'm here to kind of elaborate on anything I've said.
Dr. Max, right?
Yep.
I'll start us off. Well, first of all, I'd like to thank you for your presentation, Doctor. It was very informative, and I know a lot more about asthma than I knew before. I would like to ask you, if someone is in the middle of having an asthma attack, maybe you've explained it a little bit already, but what can someone do?
Okay, first thing to do is call 911.
Okay.
Okay. Have them stop whatever activity they're doing. Give them enough air. Don't crowd around them.
Okay.
Have them sit down or lay down wherever is more comfortable for them. If anybody in the room has albuterol, you can go ahead and give it to them.
And albuterol is
just a little puff first.
Okay, you can use anybody's, right?
Well, we don't really recommend you using anybody, but if it's an emergency and you know it's asthma, then you should try to alleviate the symptoms.
Okay.
Yes. Okay. There are a lot of theories out that certain diet can cause increased inflammation.